probably aware that in 1948 the great Clement Attlee finally finalised the legislation for the NHS, and I feel kind of sorry for him because I think he'd turn in his grave right now to see the National Health Service, the great pinnacle British institution and policy making, has now become exactly the opposite of what it was. It used to be national, and now, unfortunately, the National Health Service is not so national. You think of Britain and you think the Post Office, you think the Queen, you think the Health Service, but yet only one of these, the Queen, hasn't been privatised, although Waller would probably privatise the corporate provision. So, but unfortunately, the NHS and private firms are now owned by more than just the state. They're owned by Russian oligarchs and businessmen. The problem with these is they don't focus on the service, the national service. They focus on profit margins and spreadsheets. Now, I've answered the question of efficiency, and the bedrock argument of initial privatisation within the NHS was the question of efficiency. But let me ask you, what is efficient about having 200,000 unused beds in private hospitals? In Northern Ireland, over 20% of people are waiting over 13 weeks to get a bed in hospital. And I don't call this efficient, I call this quite inefficient actually. And the statistic for people across the United Kingdom is 12% of people are waiting over 13 weeks to get a bed in hospital. Even Kazakhstan has 3.5 times the number of beds per capita within in comparison to our country. Back when the NHS was implemented, Clement Attlee introduced grand schemes improving efficiency. 60,000 beds that were out of use were then used. And so, let me ask you, what is efficient about having the top healthcare and top equipment being used by 1%? I don't think that's quite efficient. By nationalising it, it would mean that there's more equipment and hospitals available for the majority of people, and it is just this, a national health service. And so there's nothing efficient about having Bupa, the NHS, AXA, BMI, all these polyocracy of competing organisations fighting for control over the healthcare. It's important to also recognise that after the Human Rights Act of 1988, that it is a human right to have access to healthcare. However, why is this right enjoyed by only the 1%? Why is the best healthcare enjoyed by this 1%? Because they have 2 more zeros at the end of their payslip. Shouldn't we add those 2 more zeros to the 1% which have access to these private hospitals? A truly national healthcare service isn't nonsense, it's a right, and it's a legally recognised right by the 1998 Human Rights Act. In cost effectiveness, it would be cheaper to run, although I'm sure the author would say otherwise. Companies are aiming at profit, and however the government still steps in and subsidises these private contractors. But to take a little example of another privatised business, in Germany you can get a nationalised train. You can get €8, you can go anywhere in Germany. Here you can't even go around London for 1 week for less than £8. So this is a little bit of private inefficiency. Private health contractors don't care about preventative treatment for their patients. In fact, they don't care about their patients, they care more about their patients. Ill health in a patient is desirable for private contractors, but they're just making a profit out of it. And the currently partially privatised system has private contractors aiming to service themselves and their pockets, whilst the NHS is concentrating on trying to match them in bureaucratic paperwork, whilst a nationalised health service would aim to serve the British people and ensure the public well-being.
Okay, well, first I'd just like to bring up on one of your points there. You said it would be beneficial for private healthcare services to not essentially make people better, because you want them there longer to make more money. But the thing is, if private healthcare had a large number of patients dying, people would stop using the private healthcare, and the healthcare firm would go out of business. Therefore, it is completely ridiculous to say that private healthcare doesn't aim to make people better. Because the whole point of business is you want to attract as many customers as possible. The way you do that is by making people better quicker. Secondly, you also point out how there are a lack of beds on the NHS, but there are a lot of free beds in private healthcare. Well, quite simply, if people are that desperate to get a bed quickly, they can just move to private healthcare. There is no one forcing them to use public healthcare. But also, the fact that there are so many people waiting on beds shows how inefficient the current NHS is. If you're having to spend ages waiting for a bed because other people aren't being made better fast enough. It's essentially, at the moment, the current system is fairly inefficient, and if we fully nationalised it, it would just make it even more inefficient. Another point is the fact that, I don't know whether you've heard that, currently the government's going through something called austerity. They're trying to reduce spending. So to simply fully nationalise the NHS, therefore increasing government spending, would essentially make all these previous cuts pointless. And it would be a waste of time, and everyone would be going through such hard times, like struggling with less money and everything, and it would be for no reason whatsoever.
Go on, Amber.
So, it's quite interesting that the opposition has proposed that what people should do to get to access to this free beds is to simply get private healthcare, while ignoring the fact that private healthcare is quite costly and many people cannot afford it, which is why the issue exists in the first place. But the opposition also focused a lot on austerity and talking about how this privatisation of NHS actually leads to cost efficiency. Well, that's not true. That's completely not true. And I'll explain why. So, it is often argued that what happens with the free market, the way that you make the healthcare more efficient, is you subject it to market forces, you subject it to competition. Well, and the idea that this brings costs down is actually not true. And I think the best example of this is, as always, America. And so, what America does is America has several insurance companies, hundreds and thousands of insurance companies which provide healthcare to individuals, and this is fully private health. But instead of this cost reduce, this cost efficiency that is supposed to result from this competitive market, what you instead get is costs which are highly inflated and bills which run into thousands of dollars through the most simple procedure. So, how does this occur? Quite simply, healthcare cannot avoid market failure. Because what happens is that hospitals and organizations monopolize locally their presence to emergency and essential services. And what this results is that even the most basic of treatment is that hospitals are able to charge a ridiculous amount of money for even the most simplest of treatments. So, for example, an IV bag costs to supply hospital under $1 in California. But a Californian hospital might charge you as much as $140 for the same IV bag. Why? Well, because as mentioned, what private companies have an incentive to make profit, what they don't have an incentive for is to provide the best healthcare possible. Because the idea of competition is simply an illusion. There is no competition. You do not get a choice of to which emergency room you get taken. This idea of competition completely utterly falls apart because of this. And this leads to further inefficiencies because this health service is fragmented. And what does this mean? So, in the US, administrative costs make up as much as 31% of the all healthcare expenditure, compared to the 14% in the UK. So, what does this mean? So, this means that less money is being spent on healthcare and on patients in a system, in a private-run system, while a national system, which is unified, is actually able to benefit from economies of scale, and is able to benefit from not having to transfer administrative files. And even more successfully run private healthcare systems, such as Germany, which is also based on a private insurance scheme, also actually has higher expenditure of healthcare than the UK, while having a comparably similar sum of healthcare. Germany spends 11.3% of its GDP on healthcare, compared to UK's 9.3%. Well, the services are actually of similar quality. So, it is extremely wrong and erroneous to say that introducing competitive and free market forces in the healthcare system actually modernizes it. Because that's not what happens. What happens is that you get private companies profiteering from healthcare, and you don't get any of the benefits associated with the free market, but always negative. Thank you.
Right, good afternoon, ladies and gentlemen. I'll be continuing the argument for the opposing side. And first off, I'd like to open with some rebuttals. So, Anwar did quite a nice speech about privatisation and all the problems with privatisation, and the key argument, the key sort of example he used is America. Well, America's a pretty bad example because America is simply one extreme of privatisation. It's completely privatised. And what George and
Amir.
Sorry. What Amir and George, what Amir and George would go on to say is that we're arguing for competition. We're simply arguing against the nationalisation of the NHS. We are of the healthcare. Sorry, we're not arguing for privatisation. We're not arguing for this extremely privatised healthcare that the Americans have, which, as you mentioned, does not work. But as Walla pointed out to me, there are cases of private healthcare that have worked in the past. So Australia is a good example of this. They're able to keep their population running pretty well. The budget's roughly the same as the NHS, and they can look after the Australian population fine. So privatisation can work, but you've chosen America as an example of why privatisation doesn't work. And we can find just as many examples of nationalisation when nationalisation has not worked. So since I represent the medical society in this debate, I will talk about sort of the more medical and clinical factors that are relevant in this case. And the first point is innovation. So you've talked about competition, you've talked about how competition supposedly doesn't bring down costs, which I disagree with, but I won't touch on that too much. I'll leave that to George and Amir. We're talking about innovation, and when you have competition, that promotes innovation. So if we look at how healthcare works, look at healthcare in America. There is competition, and as a result of the competition, their technology is superior to that of the UK. And the example I will use here is keyhole surgery. The Americans have this thing, well, they're 3D basically, which allow the surgeons to have depth perception, which, you know, to us it means absolutely nothing because, well, not many people here are doctors, hopefully. But it makes a massive difference. Just a small piece of technology doesn't cost a world, and it's not 100% necessary, but it makes the job easier, it makes the job better, it makes it faster, it makes it safer, because you can see depth, you won't run into an artery by accident because you can't see how far away it is. This is an example of how innovation benefits the healthcare system, and that innovation only comes from competition. Without competition, there is no incentive to innovate. Why would you go for 3D when 2D costs less? And another example I've got to talk about is the Royal Mail and Amazon. You look at Royal Mail. The Royal Mail's let's ignore the recent changes since not enough time's gone past to see the effect of it. But you look at the Royal Mail. For a long time, it's nationalised. It's owned by governments, and it does the job well. It gets everything done. But that's it. All it does is get the job done. It hasn't changed at all in the last 10 years in terms of service. Now you look at Amazon, which is a private sort of deliverer, I guess we can call it in this case, and because it's subjected to competition, it's forced to innovate over the last couple of years. You've seen new services come about, stuff like Amazon Locker and whatnot. All of these things that are there to make the service better, to innovate. And again, that comes from competition. Without the competition, that simply wouldn't happen. And Royal Mail is a good example of how it just stays the same. So the second point is this idea of choice and this idea of the premium healthcare, which the proposition talked about. So why shouldn't premium healthcare exist? Healthcare exists for all people, like you said. Poor people do have healthcare. But what I mean when I say premium healthcare is sort of these extra things. If you have the money to be able to afford a better bed, a better bath, and a better whatever you want during a hospital stay, why can't you buy it? Why should you be forced to be subject to the same standards as everyone else, which is what nationalisation does? It treats everyone the same. If you have the money, why shouldn't you be given the choice to have a premium service? And that's it.
Okay, so I too will be arguing for the medical society, and I'm going to start off with a bit of rebuttal to Charlie. You talked about how the nationalisation means that you're against competition, but really, if you do not nationalise a healthcare service, then you just have an illusion of competition, because really the competition only goes to those who can afford to pay for that competition. Those who are less well off in society simply can't afford it and are forced to go to healthcare services which are subpar to those that are available to the rich. Secondly, you mentioned Australia, which is a good example of privatised healthcare, but actually, similarly to how we use America, and you said that's a bad example, you've also used a bad example because Australia has a very youthful population, and so it doesn't cost much to actually keep them healthy because they are generally healthy as they get older. But the reason America has superior technology is because they're funded to actually research that technology. That's not a problem with nationalisation of the NHS, it's a problem with funding, and that is not a problem that is concerned with this debate. And you talk about how if you're rich, you should be given the choice to have premium healthcare. But we've already said that you can contract out services to like privatised dentists and things like that, so you can actually get a privatised service if you can afford it. We just think that everyone should be able to have healthcare. And that's on to my first point. Nationalisation it's good because you assume that by not nationalising the NHS, then you're going to solve all the problems. But the problem really isn't with the nationalisation of the NHS. It's the fact that there are a surplus of patients to the amount of doctors. Now this is solved by creating more opportunities for medic students to actually become doctors. So for example, by making the medical field less competitive and by creating more doctors, then you will solve the problem. You don't solve it by just privatising the NHS. Secondly, you also assume that if the NHS is no longer under the control of the government, then the people using the service will have more say. But that's not exactly the case, because generally, when it comes to privatised companies, you have big bosses who are interested in an economic value and who aren't interested in the patients, because sometimes treating patients is expensive. And so they will be less interested in treating those patients well if they could do something for the cheap. I mean, this is shown by ambulances now have been contracted to private companies, and those drivers simply have to be able to drive. They don't have to have any medical knowledge, and they don't have to have any first aid knowledge. All they have to do is be able to drive. And this actually is very efficient because you have to call out medical personnel who actually know what they're doing. So actually, a nationalised service means that you have more efficiency because you have to implement protocols to have medical people involved. You have to have people who actually know what they're doing in ambulances or in a nationalised service, which you don't have to do in a privatised service because there don't have to be any regulations. Secondly, healthcare should be a basic human right, and it should be something that everyone is entitled to. Now, if you don't have enough money for a privatised service, you're probably going to get a subpar service. And I don't think that's fair. I think that, particularly because healthcare is not something you can work towards. Okay, you can try and be less obese, but if you get cancer, it's not your fault that you've got cancer if it's a genetic problem. Some people get that, and it's just an act of God. It's something that's random, and you can't solve that. So why should someone who has more money be able to get a better system? Because, you know, they have more money, but really, it's not something that you can decide. If you get cancer or you get something like leukemia in children, why should that parent have to struggle to make those funds for that child to actually have the healthcare service that they need and that they require because you have a privatised system? Therefore, I beg you to propose, because it's simply unfair for people who don't have enough money to have a subpar system.
Throughout the entire prop bench, all they've done is mentioned a series of problems and then assumed that by nationalising we'd somehow magically solve all of these problems and it'll just disappear. Even Lydia's speech in herself, she mentioned that nationalisation isn't the problem, yet that's exactly what they're doing. I'm going to be talking today about how actually you're making the situation worse for people who are on the waiting list, so I'm just going to begin now. You mentioned, first of all, in the first speech about Russian oligarchs and how they only care about profit. And we think that actually that's a pretty good thing because customers' care is intrinsically linked to profit. Because if you're a customer or a patient and you go to a hospital and you get good treatment, you'll want to come back. there's an incentive for these private hospitals to actually provide good quality care so that people will come back to them, right? That's why actually in the end it'll actually have good things. That Charlie talked about how it'll drive innovation. The fact that actually private companies that put the most funding, as you talked about, funding is necessary. It's the private companies to put the most funding into healthcare so you can have the new treatments, the new vaccinations, and like the general development of medicine. And then you talked about how, oh, actually there were loads of people waiting in bed. We think that you talked about there are inefficiencies in the current system. We don't see how nationalising the service will reduce the inefficiencies. In fact, we argue that nationalisation will increase the inefficiencies because of things like government bureaucracy, because of all the paperwork that governments will put in, because generally that's what tends to happen because of middle management, and that causing there to be additional costs. And it also lowers the quality of the healthcare for everybody on that waiting list. It increases the time that people have to go on that. We also say that you're implementing a half measure because you say that you hate private companies and you tend to be all socialist, but then you go and say, actually, we're allowing private subcontractors to still exist. Don't sit on the fence. Which side are you on when you still allow private subcontractors, but then you go on to say that we hate private companies? We think we need an answer for that. Then you talk about how competition brings, you claim that competition doesn't bring the cost down. We think this is just fundamentally wrong, like year 9 economics. Like, when there are more firms in the market competing for the same number of customers, they generally tend to offer better things to attract those customers to be able to pay for that. Also, the example of the American system is something called, it's actually, the reason why they have that is because they have very high costs, but the people who are isolated are those who can't afford insurance. Under our system, which is the current status quo, we think that even if you don't have insurance, you still are able to get treatment, right? You won't go bankrupt if you can't afford it. And so additionally, moving on to, you guys talked about how it's a human right, this kind of links in. We say that actually you're still going to get treatment if you have cancer, but under your side of the model, what's actually going to happen is that you get less innovation, you end up getting people waiting longer times for cancer, you make it worse for cancer patients because they have to wait much longer hours because of government inefficiencies, right? And then also additionally, you talked about how it's the number of doctors that's important. Charlie from the Medical Society, who backs me up on this, says that it's actually says that it's the BMA, the British Medical Association, who controls the number of doctors. When you nationalise that group gets a lot more power, meaning that actually the number of doctors doesn't change by nationalising things. So, because actually you make the situation much, much worse, and nationalisation doesn't solve any of the problems that Proposition have talked to you, I beg you to oppose.
Final few points. I'd like to begin by just saying your point again. You said that competition creates innovation, but I don't think that at all. I think competition creates competition, and I'll go into what I mean by that now. By encouraging and incentivizing competition, what you're actually doing is you're saying to the private firms, lower all your costs, okay, raise all your prices, and make the most profit you can. The leaders of these big corporations that are medical centres, they're not acting in the interest of the patients, they're acting in the interest of the shareholders, because they know that they receive the highest wage when the share price of those firms goes up. The share price goes up for things such as dividends payments and share buybacks, all incentivised by those high profits, low costs. Okay. Also, you said about the increased investment. There is an increased investment because I just checked on my phone. People may have seen 170 million more pounds is being spent by the public sector than the private sector. So I don't know where your statistics are coming from. Furthermore, much of the investment that is made by the American, I don't know who invests the money, but it's going towards universities to increase innovation, and they know that they can't give it to firms because firms will do low value, poor innovation into investment, with the investment, that they won't actually learn anything from it. They know that universities will do the highest quality research and come out with best results. So I'll move on to my points why I believe that nationalising healthcare. Okay, sorry guys, but essentially, the reason economically why we should nationalise everything is that the incentives that are given to firms by this economic incentive is that they're not actually being asked to give a better service. £120 million is put into legal fees every year for price fixing by firms that they realise that someone with dementia, they don't actually understand what services they're requiring, so they charge them a higher price, and they realise that they can do that because the person receiving that medical care hasn't got the same amount of information, asymmetric information in the market that they can receive. One other point, it's completely elitist. It is completely elitist. 13% of the average person's income would have to be put on medical care if they were to receive the private care that the opposition are calling for. Also, improper payments by medical healthcare centres result to £98 million a year. So that's people paying with brown envelopes underneath the table, not giving money to the actual, not paying taxes essentially on that money. And actually, I'd just like to finish with a little story from Greece. In the height of the economic troubles in Greece, okay, where they were incentivized to have private healthcare, one doctor in Greece claimed that he only made £13,000 a year whilst working all year. So he only paid 20% tax on the 3,000 euros that he earned. So where do you think the rest of the money went? It went under the table in a brown envelope into his pocket. It didn't go to the taxpayer, and that's exactly what's going to happen when you allow private firms to be incentivized by this.
What CROP stand for today is to make the current status quo much, much worse. They've told us loads of problems with the current system. They've suggested no better on their side. We've heard no analysis from the proposition to say actually that nationalisation is much better for the patients, for the people who really matter in these circumstances. And what I stand up today in summary today is show you why actually under the status quo it's much, much better for the patients. I'll do this in one point of clash. What is best for the patients? So what we hear from proposition is that actually private healthcare currently doesn't really care about patients. When we say bollocks, we actually say is they care about getting the profit. Yes, they do. How do they get profit? They get customers through their door, they get customers buying into their private healthcare, and how do they do this? They make the conditions better. And we think actually this competition is really good for the patient on the ground. Secondly, why is Prop doing a half measure? Bite the bullet. Do you hate private healthcare companies or don't you? Don't subcontract to them and tell us actually you hate them because you're doing it anyway. You're just making it much, much worse because we can't regulate as heavily. So, what Charlie taught you is where the debate is won, in innovation. Private healthcare breeds innovation. Why do they do this? Because firstly, when you get competition, you breed the innovation. But he told you the example of the 3D scanners. 3D gets the job done quicker and better and safer, yet it's more expensive. You can still do the job with 2D, but it's more expensive to use 3D. So what happens is, under their system, the NHS just uses the 2D, and maybe 10 more patients die. Under our system, in private healthcare, we actually see lots more better patient success rate. So what have we told you? Why have we won this debate? Basically, because it's better for the patients when the current system is not nationalised, and this is why you should definitely opt this debate.